Uh, Good evening, everyone. My name is Prachi Khamkar, and I'm here to present my topic, formulation and development of antifungal film forming gel. So this is the content of my this presentation: introduction, rationale of drug delivery, rationale of drug selection, objective experimental work, results, conclusion, and references. So the generic clotrimazole is manufactured by more than 65 companies with 137 brands of generic of clotrimazole. So topical clotrimazole can be used in the form of solution, cream, ointment, powder, lotion, gel. So current players for topical clotrimazole are Glenmark, Ranbaxy, Lupin, Zydus, Cipla, and Franco from India. What are current needs of this formulation? Like this formulation has a less frequent dosing. These are the needs, like less frequent dosing, increased residence time on your skin, increased penetration, and patient compliance. So for solution for this thing, we have developed a formulation that is a antifungal film forming gel, that is a clofilm gel. Advantages of our clofilm gel is it is not easily wiped off from your skin. It stays longer residence time on your skin, increase the permeability due to addition of oil without greasiness, complete drug delivery as a drug is not wasted unlike other patches and creams, no skin irritation due to absence of strong adhesive on the skin for the drug delivery, and it is easily peelable. Rationally for drug delivery system, that is lipophilic drug cross stratum corneum easily, need of continuous permeation of the drug from the skin, creams, gels allows incorporation of lipophilic drug but fail to give a continuous release of the drug as they are easily wiped off. So addition of film forming agents in this formulation will increase the retention of gel and will give you a continuous release of the drug on the affected area of fungal infection. This formulation is also cosmetically appealing gel with a good film forming capacity, as well as patient compliance for this formulation is very good for the longer treatment. Rationally for drug, it is BCS class 2 drug with a poor water solubility. Systemic toxicity is there, hence we are only administering this drug topically. Low molecular weight for topical drug delivery. This was some experimental work which we carried out for the solubility of the drug with different oils and different penetration enhancers and surfactants. Selection of gelling agents. So we carried out experiment with the help with carbapol, HPMC E4, HPMC K15, HPMC K100, and some acrylate-based copolymer like sapinio, gallon gum, etc. So out of this, carbapol and acrylate-based copolymers were selected as a gelling agent. Selection of film formers such as Colicot, Coluvidon, and HPMC K4 were examined for the selection. Out of that, Colicot and HPMC were selected. So what is film forming gel? Actually, this formulation consists of oil emulsion, gelling agent, and film forming agent. So this formulation is organic solvent free. So this is the film forming process where you can see you can apply this formulation in a form of gel on your skin, and within some time it will get, due to solvent evaporation, this will get transferred into a form of a patch on your skin. This is the formula which we tried from FC01 to FP04. So out of this, we selected a formula that was FC04, which was having a good combination with the formulation. It was forming a good gel. And after that, we took some evaluation tests, which were QC tests on gel, that was appearance, pH, viscosity, texture, spreadability, extrudability, drug content, and in vitro diffusion studies. After that, we carried out some QC test of the film, that is film forming time, peelability, folding endurance, and tackiness. In vitro tests such as antifungal efficacy test was carried out. Animal studies, ex vivo penetration studies on pork skin was done, and skin irritation studies on Vista rat. Evaluation and results of QC test based on gel. So out of all those formulation, we found out that FC04 formula was having a good similarity factor, that is 88, when we compared this formulation with the marketed formulation of clotrimazole. So we selected this formula as it was having good drug content as well as good appearance and the film forming time, with a good film forming time. Then we made a comparison or diffusion with the marketed formulation cream and with our formulation, that is FC04 and FT02, because FT02 was having good similarity, which was near to similarity index, as well as it was having a smooth texture as well. So after comparing it with the marketed formulation, we found out that FC04 was more compatible with the market while comparing with the marketed formulation, we found more similarity index. QC tests for the films were done like film forming time, peelability, and folding endurance and tackiness. So out of that, we found that FC04 batch was forming a film on your skin within 5 minutes, which was easily peelable, and the film was continuously peeled off. Folding endurance was also good, which was 53, and it was non-tacky. So out of this, FC04 and FT02 were chosen for ex vivo studies due to high percentage of drug diffusion and for better film forming qualities. So these are the film forming after putting this film on your gel formulation on your skin. This was the observed images, like FC04, which was FC01, which was very visible, like white. FC02 was also visible on your hand, and it was little bit tacky. FC03, you can see it also formed some white patches on your skin, but FC04, it was not visible. It was translucent, but it was not easily visible. If patient is applying any of this formulation on skin, it won't be visible easily. So we went further with FC04 formulation. This is after application of this formula gel on your skin, on application, after drying, after 5 minutes, and this is peelable film form after 5 minutes. At the last image, you can see. These are the swab tests. So swab test on marketed, prepared and marketed formulation and our formulation, it was done. So swab test was carried on glass slab. We took some swabs in certain time intervals, such as 0, 30 minutes, 2 minutes, 4 hours, 6 hours, and so on. And UV results were taken. So you can see the drug content of wet swab was wet swab versus drug content of dry swab. So wet swab means the swab which was just dipped in water, and the formulation was rubbed out. And this was other one is a result for the dry swab. The blue one is the marketed formulation, which was easily rubbed off. And the red one is our formulation, that is FC04, and the green one is FC02. So FC04 was retaining on the glass for a more time, so that it can give so it was calculated as it will be giving you a good retention time on your skin. These are some in vitro activity studies with clotrimazole with the marketed formulation and our formulation. Next is ex vivo diffusion study through porcine. So here FC04, again, it was showing a good similarity factor as when compared with the marketed one. So FC04. So the skin irritation test and the stability test were carried out as per the ICH guidelines, were observed to pass the requirements and detailed studies of this process. In conclusion, the study led to formulation and optimization of characterization of novel clotrimazole film forming, which exhibits long-term treatment benefits. Advantages of film forming was long-lasting on countered area of the skin and common fungal infection, for example, nail bed, ankle, elbow, etc. So we compared marketed formulation with our formulation, whereas marketed formulation was wiped off easily and ours was wiped off resistance. Repeated application needed in marketed formulation, whereas increased resident time in our formulation. Poor patient compliances, where we try to improve the patient compliance. Next is skin irritation, like if we are using some patches, clotrimazole patches or something like that, so it may cause skin irritation, and here there was no skin irritation observed. Pain on peeling off the patches, but here there was no the formulation was easily peeled off. These are some references.